Vicki. I'm Dr. Arden. Nice to meet you. So I see you're coming in for some headaches that wrap around the head. They started about 2 weeks ago, and you've had some lower back pain that's been going on for forever, right?
Yeah.
All right, tell me a little bit more about this.
I think the headache, they have to be from stress, because like since it's so recent, it has to be the stress that I'm going through. Low back, I don't know, maybe there's something wrong with my bones.
Okay. Does your lower back pain, does it radiate down your leg? Does it travel? Do you ever get tingling? No radiation. What do you do for work for stress?
I've been doing just a lot of management projects. So I'm sitting down a lot.
Is there anything else that you would like to go over today?
No.
No, just that? Well, I also see that you've never been to a chiropractor before. I'm so happy that I'm your first. So you go to 10 different chiropractors and get 10 different explanations. So I'm going to tell you a little bit about what we do in the office, okay? So we look at the spine as a whole, okay? So your brain sits up top, it sends signals all the way down, all right? Those signals come out of your nerves at each single level. Those nerves control everything in your body, okay? Every muscle, organ, tissue, cell in your body, all right? When you can walk, talk, eat, digest, have pain, have the lower back pain, have the headaches, not have the lower back pain, not have the headaches. When those nerves are working, they're functioning, they're helping your body heal. When those nerves aren't working, that's when your nervous system starts to break down and you start to get the symptoms you have, okay? So, what we're gonna do today, let me put this back on. What we're gonna do today is we're gonna test those nerves from head to toe because we never know where your symptoms are coming from, okay? And then after, what I'm gonna do is I'm gonna put together a report, all right? When I see you again, we're gonna go over your report, we're gonna see if you're a good chiropractic candidate. If you are, we're gonna get started right away on care, and if not, I wanna make sure I point you in the right direction, okay? So now what I'm gonna do is I'm gonna ask you just a couple health questions, all right? These questions help us get a deeper meaning of what's going on because each of these questions actually correlates with nerves on the spine, okay? So do you ever get blurry vision?
I have contacts.
You wear contacts all the time?
Yeah.
Okay. Do you ever get ringing in your ears, trouble hearing? Do you ever have trouble smelling or swallowing? Do you ever get shortness of breath? Any chest pain? Do you ever have acid reflux or indigestion?
No.
Do you go to the bathroom at least once a day?
Yeah.
One of the reasons we ask that is if people have lower back pain, those nerves that come from their lower back control their bowel or bladder, so they could be constipated. Do you ever get weakness or numbness in your hands, feet, arms, or legs? Do you ever get dizziness, blurry vision, anything like that? Do you ever vertigo, nauseous, anything? Have you been diagnosed with any sort of anxiety or depression?
Thankfully.
Any memory loss?
No. Well, forgetful.
Forgetful? Is there any chance you're pregnant?
No.
And how is your sleep at night? Is it good, bad?
Difficult to fall asleep.
Difficult falling asleep? Whenever you're asleep though, can you stay asleep?
Yeah.
Okay.
I'm down.
Okay. So now that we're done with the history part of the exam, I'm gonna have you set up on the table. Take everything out of your pockets for me and we're gonna move on to the examination part. Okay, I'll be right back. Alright, Vicki, so now what we're gonna do is we're gonna move on to the physical exam. Alright, so we're gonna test those nerves. Okay, so the first thing I'm gonna do is I'm gonna test your reflexes. Alright, so just relax. So reflexes are a good test because one, you can't control them, and two, they give us good data. So all these ones I'm testing right now come from your neck. So as you can see, the right side, was decreased. All right, so that nerve comes from right back here in your neck, okay? So that one's not firing as well, which could be a contribution to your headaches, okay? All right, the next one we're gonna do is we're gonna test your lower back. All right, so your left one is called S1. That comes from right back here in your back, okay? So that one didn't fire as well as it should be, which could be another contribution to your lower back pain you're experiencing, okay? So the next test we're gonna do is we're gonna do Strix, all right? I'm not testing to see how strong you are, I'm testing those nerves. So I'm gonna put your hands up like this. Don't let me push down. Good. Good, now like you're doing a bicep curl. Pull, pull. Good, now I want you to push against me. Push against me. All right, I want you to have your wrist up to the ceiling for me and hold them strong. Good. Hold them strong. Good, now reverse them. Good. So you see how you were weaker on that side? So again, that nerve comes from right back here in your neck, okay? So again, could be another contribution to those headaches, okay? Alright, last one, I'm gonna have you go like this for me, and don't let me pull them apart. Alright, now we're gonna do your lower back, so I'm gonna have you raise your knee up to the ceiling for me. Good? Raise your knee up to the ceiling. Okay. Any pain with those? Alright, when you push against me. Good, push against me. You see how you're stronger on this side than you were on this side?
Yeah.
So again, that nerve comes from right back here in your lower back. So it could be a contribution to where your lower back pain is coming from, okay? Alright, now what I want you to do is I want you to pull towards yourself. Good. Pull towards yourself. Good. Toes up to the ceiling for me. Don't let me push them down. Good. Now toes down to the ground for me. Don't let me pull up. Good. Good. Alright, so now what we're going to do is I'm going to have you stand on up and we're going to do range of motion, okay? So range of motion is really good because there's two reasons people can't do range of motion. Either the structure, your spine, has a curve in it, so you are not allowed to turn one way, or the muscles around your spine are so tight that you can't turn one way, okay? So I'm gonna have you bring your chin to your chest. Alright, look all the way up to the ceiling. Any pain with those? Okay. I want you to look to your right as far as you can. Look where you're left. Alright, look to your right. You're fine. Look to your right as far as you can now. Okay. I want you to
I
bring
had some discomfort.
pain in the left side or the right side?
They both had it.
Both did. So it could be another contribution to those headaches you're having, okay? I want you to bring your right ear to right shoulder. Okay, left ear, left shoulder. You see how much further you can go to your left than your right? So again, those nerves come out that area, which could be a reason, again, of those headaches. Alright, now I want you to bend over and touch your toes for me. Any discomfort in that lower back?
No, just the hamstrings.
Just in your hamstrings? Okay. Alright, hands on your hips for me. And I want you to extend all the way back. Any pain with that in that lower back?
A little bit.
A little bit. Middle, right, or left?
Right.
Good. Hands by your side for me. And I want you, same thing we did in our neck, you're going to tilt. Okay? Any discomfort in that? Okay. Alright, last thing we're doing is I'm going to have you sit on down and I'm going to palpate. So what I'm looking for is I'm looking for those vertebrae to move separately. Okay? Once they don't, they lock up. Alright, when they lock up, it's going to do three things. It's going to shut that nerve off. It's going to cause those muscles to contract and spasm. It's also going to lead to faster bone degeneration and disc generation, which eventually leads to arthritis, and we don't want to get there. Okay? So I'm just going to palpate down. So do you feel that? That's where it is. So again, that nerve is shutting off, which is having your bone misaligned, which isn't able to travel where it needs to go, okay? As you can see, your posture's forward as well, which is a contribution. You see how I move your whole body with that?
Yeah.
Alright, so that bone isn't moving separately, alright? It's stuck together, so it's gonna hurt, okay? Keep going down. Alright, same thing right back down here, okay? So it's not just that muscle type, but that nerve is causing that muscle knot and it's causing that bone to misalign. I'm gonna put my hands on your hips, okay? Okay. Alright, so now what we're gonna do is I'm gonna have someone come in, we're gonna take some x-rays because you can't hide from x-rays, and then we're gonna see what's going on, okay? Alright, so if you wanna stand up, we'll take some x-rays right here. Alright, click, 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 click. Okay. Alright, Vicki, so we did a lot today. We took some x-rays, we did a lot of examination, and we took a history. I do want to dedicate some time before I leave the clinic today to go over your x-rays and go over your exam findings, put together that report I was talking about. Again, see if you're a good chiropractic candidate. If you are, we'll get started right away on care. If not, I'll make sure I point you in the right direction, okay?
Alright.
Is there a time that works best for you the next 2 to 3 days to come back?
Friday.
Friday? Okay, morning or afternoon?
Afternoon.
Afternoon? Alright, let's go get that scheduled. Thank you.
You're welcome.